Discover a better way to improve your bottom line and the procurement process in our episode today. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Hi, everyone. Today we have Luká Yancopoulos, CEO and co-founder of Grapevine. He is an entrepreneur with a track record of innovation and consistent delivery in the healthcare industry. The innovative solution built by Luká and his team allows Grapevine clients to save up to 84% on the cost of the medical supplies, shaving off over 90% of their order time, and work with multiple vendors, all while increasing the velocity of their procurement and deliveries. Thank you so much for joining us, Luká.
Thank you so much for having me, Sabrina. I'm a huge fan of the show, and I'm very excited to be on this side of the microphone today.
Yay, I'm glad of that. I always, I'm not sure whether I should be surprised or not when people come on the show. It's like, yeah, I've been listening. I've been checking you out. I'm like, oh, that makes my heart feels great.
Well, I know what you're doing, matters, and it matters to a lot of listeners out there. And, for those who are listening, know how important your time is, and know I appreciate how important my words are for you.
Yeah, because every special guest speaker on our show, they're either leaders in the industry helping healthcare entrepreneurs to grow, or they're already an organizational leader who wanted to see potential innovations and solutions in the space to help our patients, caregivers, or our providers like ourselves to improve, to do better, and not to burn out. And of course, no matter what, healthcare is still a business. There's still an investment and the output. So we all come together to say, how do we solve the delivery of healthcare as well as keeping us in the state that we can actually have enough revenue, be more productive, and be able to enjoy all the work that we do. So could you share with us who you typically work with and collaborate with, and what is the solution that you're making a difference in the healthcare space?
Absolutely. And I couldn't agree more that healthcare providers, have their hands full between patient care, for practice owners or independent practice owners. They're dealing with the financials, the business ownership aspect, even things like, marketing and media management, right? So there's a lot to balance there. And our business focuses on those independent practices. So either single physician practices, or more often our sweet spot is really physician groups, a few locations, specialties that include, oncology, dermatology, cardiology, where medical supply costs are a real burden, right? For other specialties, they're not as much of a burden. But yeah, Grapevine, for these sort of physician groups, multi-location practices, Grapevine's an AI-powered supply chain consultant for those independent, physician groups. And what I guess I mean by that is, like I said, healthcare is complicated, and owning a healthcare business is even more complicated.
By streamlining supply chain process, Grapevine significantly transforms healthcare's management. Acting as an AI-powered consultant, it dramatically reduces supply costs, which constitute a major part of healthcare expenditures. This reduction ranges from 50 to 85%. It's not just a financial relief, but a strategic enhancement, allowing practices to allocate more resources toward patient care. Grapevine's intelligent approach ensures cost savings are achieved in the most efficient manner, making a pivotal shift toward more financially sustainable and patient-focused patient operation.
When you're dealing with and trying to prioritize things like patient care, supply chain management can sort of fall to the wayside. And that's where we come in. Supply costs are often 10, 20% of a practice's, overall expenditure. And Grapevine, acting as an AI-powered supply chain consultant, is going to help you lower those costs by 50, 80, 85% in some cases. There's some more details I can get into on how we do that, but I guess, yeah, that's the high level bird's eye view of what we're doing.
Exactly. Every business needed to pinpoint a solution that's helping to improve the system. And you guys are able to identify that solution by tapping into the 20% cost into supply chain and make that more smoother and be able to save costs. I believe is, as you're saying, through technology, right? Everyone is looking into how AI can help us in healthcare, and we know there are solutions. Now it's really you guys being in open for how many years now?
We actually only launched last January. We're a pretty new business. Yeah.
Your new business, tapping into the nuances of what technology marriage with healthcare and bringing solutions, and you're growing pretty well, as we were talking about right before the show. So are you guys in, how much funding have you raised? And then what are some of the milestones that you have achieved so far?
Yeah, absolutely. So probably our platform went live to the public last January. And about 6 to 8 months before that, we were fortunate to receive funding first from my university, my alma mater, the University of Pennsylvania. They awarded us this President's Innovation Prize for the number one startup idea of graduating seniors that want to make a positive impact on the world. So they really started the snowball of fundraising for us, giving us $250,000 of non-equity funding and introducing us to a bunch of angel investors and venture capital partners. And we rolled that up into raising a few $1,000,000. And from there, built out our software and launched the platform that it is today. Just 8 months after the fact. From there, we've been, growing fast. Launch was definitely our biggest milestone. I think more than 50% of startups in America actually fail before they get to a launch, which is a crazy stat. And then from there, we, had a few small customers and really spent some time puttering around, figuring out what the best sort of approach, both in connecting with people's problems, but also solving those problems, right? So our initial launch of Grapevine wasn't the most valuable thing for physicians, for, business owners of healthcare practices. But we slowly sort of dissected the situation and came to understand the real problems that, these physician groups faced. And we're able to build smarter and smarter solutions. We're releasing new versions of our software every 2 weeks since our launch to today. So we're constantly iteratively improving. And we do that with an ear to the wall. We listen and interview all of our, users, the healthcare practices, as often as they're willing to, talk to us. We want to hear about what doesn't work, what's the most valuable thing that Grapevine's offering them, why they're here, and how we can improve it. And then we show them sort of mock-ups and designs of the things that we're building and ask them for feedback before going out and developing it. So I'm very excited. Next Wednesday is our next release, and we're releasing a whole slew of new tools for, for a new sort of business type that is joining Grapevine. So we're pretty excited about that. But yeah, we're managing today over $12 million of spend per year annualized. So people are purchasing more than $12 million of medical supplies in over the course of a 12-month period, and they're doing that through Grapevine. And Grapevine's really built on two foundational principles. I guess, like, for one, this aspect of procurement is a laborious burden for a lot of practice administrators, right? The idea of, well, either they're going to just buy everything from McKesson because McKesson has everything you need, or, as physicians know better than anyone, specializing matters, right? Like, a primary care physician isn't going to be able to treat an oncology patient the same way that an oncology specialist is. And that example sort of stretches all through the supply chain. There isn't any one supplier that is going to be the best at delivering to you or giving you the best price on all possible products, drugs, medical devices that you need.
Grapevine reform healthcare management by simplifying the complex supply chain process. It alleviates the burdensome task forced by practice administrators in managing multiple vendors and practice strategies. By consolidating these options into a single AI-powered platform, Grapevine streamlines procurement, enhancing operational efficiency and cost effectiveness. This innovative approach allows healthcare providers to focus more on patient care and less on administrative logistics, making a strategic shift towards smarter and more efficient healthcare operations.
It's important to find specialized partners to work with in the supply chain. But like I said, that's a laborious burden for practice administrators. Managing 10, 20 different vendors takes more effort, right, from the person ordering supplies than managing one. Analyzing which vendor has the best price or what to do when there's a back order, it's a burden, right? And it takes time and effort is money at the end of the day for these businesses. So that's where we come in, right? We help you sync all of your vendors into one purchasing platform. So you log into Grapevine, it's totally free. And you link your Henry Schein account, you link your Medline account, you link your McKesson account. And now your shopper or practice admin is able to sort of see those products side by side. They can pull up the same product manufactured by Becton Dickinson and resold by all three parties and see which one's going to have the fastest delivery time, the lowest price, and really cater things to their purchasing needs. But that's not really where we stop. That's really just where we start. So linking in all of your vendors to analyze the best options within your vendor network, or even gain the ability to bring on new vendors and manage them more easily. That's sort of part one. We call that e-procurement, electronic procurement. And part two is really this idea of a market cloud or a marketplace, right? So beyond the vendors that you already work with, we've got a network similar to a GPO of hundreds of different specialty vendors, the ones that actually sell to McKesson, the ones that sell to Henry Schein. And we make those directly available to you and instantly purchasable supplies. So you can sort of cut out the big middleman and his markup, that middleman being McKesson, where there's an opportunity to save money for your business. So you're getting access to a wide pool of vendors that you can click and buy from, but you're also able to manage all of your existing vendors and all of your new vendors in one platform, one website, and it's totally free to use.
Right. What you're saying is, how do we make operational efficiency the best way? It's about integration. It's about connecting all the dots and not going through 10 different sources and still don't know that each of them have their own workflow. So when you bring everything into one workflow, it's much easier. Now, our audience are great at supporting, and I think all of us love to leverage community to help us. So what would be one or two things that you would want our audience to help you with?
Well, Sabrina and I were talking about this before we started the recording today. But we've recently turned off marketing. I mean, the idea of sending out cold emails or putting up ads on LinkedIn to try to capture attention of, new potential business owners in the healthcare space, it doesn't resonate with me, as much as, a referral. So we're getting sort of 10 new signups from existing customers referring, other businesses that they know and business owners they know and doctors and physicians that they know to the platforms every day. We're getting 10 new signups. And that's the way I like to grow, right? You guys have a better idea of who's similar to you, who's struggling with the same problems that we're talking about here today, than, LinkedIn or, any cold email list, is going to really help us match. And I think matchmaking in that way, so we can find sort of similar players, similar business owners that have similar problems, and we can continue to roll out this solution to help people on a broader scale. I mean, that's my number one agenda. So if people, if you like what we're talking about here and you're connecting with the problems that we've identified, I would definitely say spread the word, tell people about it, and let's make some change in this industry, together. And I'm a big believer in the community aspect. All my co-founders are my best friends from my childhood and college and different walks of life. So I think community is really important.
Perfect. And as we scale any business, it always comes with challenges because there's ebb and flow in how just our social environment, our resources changes, and our talent pool. So could you share with us some strategies or approaches you found effective in navigating and overcoming some of the growth pains that you have experienced?
Yeah, I think that both finding people that are as excited, right? And I think this is every sort of small business that's undergoing that scaling sort of stage. Finding people that are as excited to work on and to drive forward progress on your agenda after you've got that sort of core team, and expanding that, I think, beyond, 10, 15, 20, 25 employees. There's often sort of a level of disconnect between the new hires and the, and the original co-founding team, right? Whether it's a practice admin or it's, a nurse, knowing and having a real connection with the business owner, of a medical practice, right? There's a real connection there up to a certain scale. But when you go to a large hospital or a huge conglomerate, do people really care about, the overall business, or does it become more little siloed pockets of having your own communities within that greater pool? I think that maintaining sort of the integrity of our mission and the alignment of our team as we grow and bring in new team players is a serious challenge for us. And then also, having the right number of people as we're rapidly growing is a constant challenge. We need to be bringing in more people. Bringing in more people requires more money. And then we look to our investors to say, hey, we've got these different metrics that show success. How about you dig a little deeper into those pockets?
Exactly. I think talent is so important. The human capital it's the core of any business. And you said it exactly right. It's about your passion, your alignment of what you as a visionary sees in the solution you're bringing. But how do you convey that so everybody else in their core is believe the way that you do, and so you can grow all together, building onto each other. So thank you so much for this amazing interview. You share a lot of great resources, and then really helped some of the other entrepreneurs to see the differences between, yes, strategic partnership is amazing. We can leverage that really well and continue to build on that. And we needed to really make sure the people that we hire is the right person with the right talent in the right seat. Because too many times we've seen the wrong people in the right seat or the right people in the wrong seat. It just doesn't work. So how can people find you if they'd like to connect and learn more about your work?
Yeah, absolutely. I think the number one way is, and we've got a whole support team that'll sort of back you up. I would say go to go-grapevine.com. That's go-grapevine.com. And again, sign up for free and our customer support team will be in touch with you same day. Alternatively, if you want to speak to me directly, although I'm sometimes a little slow to respond to my email inbox, you can hit my email. It's Luká, Luka, at same website, go-grapevine.com. So Luká at go-grapevine.com. It may take a little longer to get back to you that way, but I welcome any sort of questions, ideas, or interest, in my email inbox.
Imagine a world where healthcare providers no longer have to choose between financial viability and top-notch patient care, where independent practices can thrive without the overwhelming weight of supply costs. That's the world Grapevine is thriving to create. Although a newer company, it already have been able to help many of their clients. By focusing on the needs of physician groups in specialties like oncology, dermatology, and cardiology, where costs are particularly burdensome. Grapevine's AI-powered supply chain consultant is more than just a tool. It's a game changer. Here are the 5 key points we discussed today. Number 1, the crushing weight of supply costs. Healthcare professionals face the unresolved challenge of soaring supply costs, which can account up to 20% of total expenditure. Grapevine offers significant financial relief, especially in specialties with higher costs, by transforming healthcare management and prioritizing patient care. Number 2, powered by AI as your ally. Grapevine's innovative way to supply chain management by leveraging AI for market analysis and personalized recommendations. It's not just about saving costs. It's about informed decision-making and operational efficiency. Number 3, tailored solution for diverse needs. Understanding the unique requirements of various healthcare specialties, Grapevine provides customizable solutions to enhance operational efficiency. This approach ensures that each practice can optimize its supply chain effectively. Number 4, continuous evolution, a commitment to excellence. We all, as innovators, commit to continuous improvement, regularly update based on user feedback, and stay ahead of the curve. This proactive approach ensures practices are equipped with the latest tools for operational excellence. Number 5, building a community of innovators. For Grapevine, it's more than just a platform, it's a community driven by a more efficient, compassionate healthcare system. Members collaborate to redefine and evolve the platform, fostering a collective approach to innovation. Now, today we talked about the AI-powered insight and community-driven growth. It's not just about cost reduction, it's truly about enhancing patient care at the end of the day. How can we master operational efficiency? As we evolve with AI-empowered tools, it also invites you as a healthcare leader to contribute to this revolutionizing design. Are you ready to adopt different AI tools into your practice? Share your experience and insight with us by posting on LinkedIn and tag me, Sabrina Runbeck. We would love to join you on the conversation. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.